not just here, but across the country. Nearly 250,000 people in mid-Michigan rely on Medicaid for their health care, including tens of thousands of seniors. Long-term care providers especially depend on Medicaid to fund the important services they provide for our seniors. I know that for me, it was Medicaid that allowed my mother to pass away in her home in the way that she wanted, surrounded by her family. Today, we're at the village of Hampton Meadows. There are dozens of other senior care facilities across our state just like this one, full of residents who are staring down the barrel of almost $900 billion in cuts to Medicaid. This extreme budget plan that the House Republicans passed last month makes $900 billion in cuts to Medicaid, which will lead to seniors losing their health care coverage and, frankly, many of them getting kicked out of nursing homes. Not only that, but those cuts will kick 30,000 people right here in mid-Michigan off of health insurance, risk the closure of rural hospitals, and raise health care costs for everybody. So why would they do that? It doesn't seem logical. Well, here's the answer. It's to pay for tax breaks for the wealthiest people and companies in our country. It's cruel and it's unacceptable, and we know that our seniors deserve better. I want to say that I voted against that budget plan in the House, and I will always stand against cuts to Medicaid and other vital programs that our seniors really rely on. But the fight's not over. As this bill continues moving through Congress, we will continue standing up for our neighbors and raising our voices. Today's press conference is one example of that, and I am grateful to see our community rallying to make their voices heard, because facilities like this are far more important than padding the pockets of the uber wealthy. Now, I'll pass the podium to someone who can tell you more about how these cuts will impact nursing homes and seniors in our community. Roger Myers, the President and CEO of Presbyterian Villages of Michigan.
Thank you very much, Congresswoman. We appreciate your staunch advocacy on this important issue. It does matter to so many folks, and particularly the people that we serve here at the village of Hampton Meadows, and also in your district in Flint with the McFarland Home and the Court Street Villages. So we see every day seniors that rely upon Medicaid and Medicare for their health care. And whether that's health care that's provided in a hospital or outpatient clinics or in long-term care facilities, or, as you said, in home and community-based services, like you understand with the Medicaid waiver program. You're going to hear from the area agency in a moment on that, as well as PACE, the program for the all-inclusive care for the elderly. About 2/3 of the 10,000 people that Presbyterian Villages of Michigan serves across the state rely on Medicaid. It is essential that Medicaid remains strong. It is a vital program. Again, it's critical to the health care and overall quality of life of the people we serve. And you're going to hear now from Monica, who serves as the interim executive director of Region 7 Area Agency on Aging right here in Bay County. Monica.
Good afternoon. My name is Monica Fryer. I'm the interim executive director for Region 7 Area Agency on Aging. And I want to thank Congressman McDonald-Rivet for this wonderful opportunity to speak on behalf of all the seniors we serve across our 11 county service area in mid-Michigan. This is such an important topic that touches so many seniors who receive services through our agency. We are an aging population. By the year 2030, 1 in 5 Americans will be over the age of 65. These are the very people who worked their whole lives, raised their families, participate in their communities, and want nothing more than to live out their golden years in their homes surrounded by family and friends. They did not do all these things to be viewed just a number on a budget line and placed in institutional settings against their wishes. Those are harsh words, but they are the reality of what could happen should home and community-based services such as the My Choice Medicaid waiver program, be cut or reduced as part of the next federal and state budgets. The My Choice Medicaid waiver program provides essential in-home services like personal care, meals, and respite that keep thousands of older adults and individuals with disabilities safe, independent, and in their homes. These lifelines prevent costly hospitalizations and nursing home placements. Home care through the My Choice Medicaid waiver program costs less than half of nursing home care, saving Michigan $539 million annually. Over 16,000 adults were served by the My Choice Medicaid waiver program statewide last year, and that number continues to grow. 90% of those program participants expressed that they are satisfied with their care, and 3 out of 4 individuals want to age at home, where they are healthier, happier, and more independent. Every dollar invested in home-based services helps prevent expensive hospitalizations and long-term care placements. Home care keeps families together, preserves dignity, and saves taxpayer dollars. For over 50 years, programs like My Choice Medicaid Waiver have enjoyed strong bipartisan support because they work by helping people age at home while saving Medicaid dollars. Without sufficient investment, Michigan risks devastating consequences for families, communities, and the healthcare system. My staff and I, on behalf of Region 7 Area Agency on Aging, feel honored to have the privilege of taking care of and advocating for the seniors all across mid-Michigan. I implore you to advocate against Medicaid cuts that would affect the lives of so many seniors and communities they live and thrive in each day. And now I will pass it on to one of our My Choice Medicaid waiver participants. Her name is Kathy Rouster, and she would love to speak to you. I think they need to set this up for her.
Let's just pause for a second and I'll bring the mic to you. Okay? I'm not gonna help us here. Is it okay to sit in? That's it? Yes. Do you want me to hold the phone? That'll be okay. I'm not sure whose phone this is. Okay, all right. Go ahead.
Okay, my name is Kathy Rouster. I'm from Saginaw, Michigan, and I'm in the waiving program. And with the cuts of Medicaid, we all need Medicaid, just not just for disability, for all. And without the Medicaid, of course, I'm on life support, and I sleep with oxygen tank, and I want to stay in my own home, in my own apartment. I love my home. I've been there 9 years in Carlton Village. So with the cuts, it will affect us real bad. I mean, because a lot of us, like me, I can't sleep without oxygen, and I can't sleep without my sleep app. So we really need to keep Medicaid, keep it alive for everybody, because we all need, and it really helps me. It's been help me. So.
Kathy, how long have you been in your home?
I've been in my home 9 years.
9 years?
Yes, I stay in Carlton Village, yes.
And this is what helps you stay there?
Yes, yes. The program reaches 7, yes.
What would it mean to you to have to leave your home?
Devastated. I've been there. I love my home. Why should we have to move out of homes? You know, if everybody's satisfied where they're at, should nobody have to be moved? I mean, it's working for everybody. There's no reason to cut out Medicaid. No reason at all. And he really need to look at Medicaid real strongly, because we all need the Medicaid to stay alive. So, and I'd like to say thank you for having me.
Of course, yeah.
Okay, thank you.
Thank you.
And next, I'd like to introduce, Jim is coming up to speak. Thank you very much, Jim.
Thank you.
Thank
Can we
you.
just hang up for the mics to come back?
Okay.
Thank you guys for helping with this.
Thank y'all.
Yep. And I just want to begin.
Yeah, second, sure.
Good.
There we go.
There we go.
Once in a while,
doesn't want
Yeah.
to cooperate.
Yeah, thanks. Yeah, thank you, Congresswoman Rivet, for organizing this press availability today to share with residents of Bay County and the region, especially our visitor from Saginaw, and the impact that all of the constituents that you represent in your 8th district will be impacted by these cuts. And I want to say that there's not a lot I can add other than I know how important the PACE program is in terms of keeping residents in their home, because we know that people age better in their home than they do in a healthcare facility such as a long-term care facility, nursing homes. The average cost, I think, in Michigan is $11,000. I know some of the costs on our local nursing homes right in here in Bay County for private pay is $12,000 a month. And remember that with the PACE program, we can keep people right in their homes where they will age better at about a third of that cost per month. So it's a major tax savings for the Medicaid program if we continue to support programs like PACE and the other home health care services that Medicaid provides. And I know that we have 2.6 million people out of 10 million people who rely on Medicaid for their health care. And that represents about 27% of Michigan's population. So that is a significant number of people who will be impacted, not to mention the cost in the emergency rooms. Any hospital, healthcare provider that has an emergency services or urgent care department must treat, without regard to ability to pay, a person who presents himself in a life-threatening situation. So when that person then gets very expensive care because they've delayed, if they're not on Medicaid, they've delayed seeing a healthcare provider until it's at the acute stage, which when you go to an emergency, emergency medicine in a emergency room is the most expensive healthcare that is provided under our healthcare plans. So many hospitals will be hurting financially if they don't get coverage for people they have to under federal law. If they accept Medicare and Medicare and Medicaid, they must provide that health care. And if they cannot collect that, that is passed on to other patients that they're serving. And we know that I think we're in pretty good shape here in Bay County, but some rural areas that depend on their maybe one or two local hospitals, smaller hospitals, provide their health care needs, and oftentimes they're also some of the largest employers in those rural counties. So the impact of Medicaid cuts will be extensive, reaching out and touching a broader population than just Medicare recipients or those covered by Medicaid. So we hope that as this package has moved from the House to the Senate, that the senators will look at Medicaid cuts with a surgical scalpel rather than a meat axe approach that will put many, many people, vulnerable people, in danger of facing serious health consequences and possibly losing their life if they don't get adequate medical care. So I'm here today to kind of just speak to how important PACE and Medicaid is to all of our vulnerable citizens. And, at some point, all of us, if we go into a nursing home, how many people could afford $12,000 a month? How long would your assets and your savings last? And then when that is expended, that is when you will go on to Medicaid. So it's a very difficult process to actually get onto Medicaid. You have to dispose of your resources, your savings account, and eventually your home to qualify for Medicaid. So it is not just given out willy-nilly to anybody that seeks it. There are very stringent regulations in terms of who qualifies for Medicaid coverage. So with that, thank you, Kristen.
Thank you, Jim, for your remarks and providing leadership in Bay County for several decades. As a county executive, I know that seniors in particular are your number one priority. So very much appreciate that. So you heard from people who are experts Whether they're receiving the services or administering the services, Medicaid is vital to our community, vital to our seniors, vital to families, and is the thing that actually powers our rural hospitals. We cannot withstand $900 billion of cuts. And with that, I'll take questions.
How do you respond to claims that Medicaid needs reform, not more funding for senior care?
Well, so let me say this. I do think that there is room in Medicaid to eliminate a lot of the bureaucracy and red tape and how hard it is to navigate. There is no plan to actually do those things. This is just a whole-scale cut and pushing an enormous financial burden onto the states. That is not what this is. This isn't about reform to make it easier for seniors. This is about taking care away.
And then if the cuts pass, are there any backup plans to support seniors at the local level?
Here's what I know for sure. Local communities, whether we're talking about our city governments, our county governments, do not have the resources to pick up this enormous burden if the federal government decides to make these kinds of cuts into our Medicaid system. It's just not financially realistic.
So why does the GOP want this?
Because they're trying to pay for massive tax cuts for the uber wealthy and already wealthy corporations.
Thank you.
Okay, well, thank you so very much. Thank you.
Thank you. Thank you so much for having me.
Yeah.
Thank you again.
He sends his regards.
His house?